So good morning, Dr. Dinos. How are you?
I'm good. Bom dia. I believe you are in Portuguese.
Wow. Wow, exactly.
I have to start practicing my Portuguese.
Yeah, and I should practice my English as well, you know.
So if I reply to you in Portuguese and you ask me in English, I think people will get really confused.
Let's go. So first of all, I need to thank you for having us and to be here with you, and you know to drive this kickoff on the 40 talks on the 2021. And
it's a pleasure. It's a pleasure, Ricardo.
No, my pleasure this time. And actually, you know, I was and I am very, very excited for returning this 40 talks that were a blast in the last year. You know, it was kind of, you know, a good vibe and an amazing energy during the pandemic, and you know, having the opportunity to learn with all these MODJAW users and having the possibility to share knowledge around the world and you know, around our community.
I think that was the only good thing about the pandemic, that digital went really, you know, all over the world, and that's great because we are doing something like this even now. You know, we connect with people from all over the world, and it's like we are all a big family.
What time is it now there?
4:30 here in the Gold Coast in Australia.
4:30 in the afternoon. So it's 7:30 in Portugal right now, and so on one side we are just starting the day, on the other we are ending the day, and this is, you know, the amazing thing is actually, you know, the possibility to exchange and have this conversation with you in a total different time, in real time as well.
Amazing. It's amazing.
Amazing.
You know, it feels like you are in the room next door. You know, it's so good.
Exactly. So Dinos, tell me one thing.
Good.
Introduce yourself and your clinic. Let's talk. Let's have this talk and let us present yourself and your clinic, so people understand exactly what we're talking about and who we're talking about.
I came to Australia about 3 years and a half ago. I'm associated with a clinic called Dental Implants and Aesthetics in Southport in the Gold Coast. And we are an amazing, very, very powerful team here, doing a lot of very good quality dentistry with all treatment modalities. We have all the specialties here. And it's really, I feel very, very privileged being here and doing some very good quality work in the last 3 years. Initially, I was in Greece, and a few things happened, and I made the move to Australia about 3 years and a half ago. And I can tell you for sure, I don't regret it. It's a lovely place here.
So, for how long are you a MODJAW user?
Well, I bought the MODJAW, it was just, I think, about August last year. And I got introduced to the technology from a very good dear friend, Dr. Ian Buckle from Liverpool. And we share a lot of common grounds with Ian. We both believe and we follow the DAWSON Academy philosophy. And when I had a little talk with Ian, he told me that he got this amazing machine that I have to see it. So I tell him, you know, I think it's a little bit difficult for me to see it because we are confined here in Australia. We cannot fly anywhere. So he told me
that was a blast, right?
That was a blast, you know. So then, so he told me what this can do. So I said, I might as well buy it and try it. And I can tell you, I don't regret it. It's an amazing technology, you know. And you know, talking about a little bit about the DAWSON philosophy, always, you know, we try to do and form the anterior guidance in harmony with the envelope of function. And that's what we were always trying to do with the provisionals. to be able to make provisionals and accept the provisionals and fine-tune the envelope, the anterior guidance with the envelope of function.
Wow.
And it's an amazing, amazing thing. And that's what really struck me. And I bought MODJAW. The MODJAW machine is that I can actually see this envelope of function and I can measure it. And that's amazing. Before I even do any provisionals. So I can form my treatment and I can form the teeth and the shape and the contacts according to an envelope of function that I can see and measure. And that's an amazing, amazing technology. And that's what made me join the family.
Decide moving forward. So how digital were you before MODJAW? How, what kind of workflows were you using back then?
Well, not much, to tell you the truth. I'm a very traditional guy, and I've been analog, up to 2 years ago. And then I started doing the digital smile design and going with CAD restorations. And MODJAW was the big kick for me, to go digital. And the truth is, that digital is the future. I mean, if, like me, plan to work for the next 40 years,
There's no doubt.
You have to be on the digital train. It's something. Sure. I mean, if you are ready to retire, it's okay. You can do whatever you used to do. But if you are, having at least 5 years work in front of you, I think you have to go digital. There's no other way. And it's an amazing. We love technology. I love gadgets always. I love to play and do stuff and try. And what I really liked about MODJAW is that it's an open system. You can do anything you want and things can become better. So I love that there is this MODJAW users group. So everybody's sharing experiences and we are all learning from each other. And this is great because that's a new technology, new application. Someone finds something that they can do in their daily workflow, share it with the rest, we try it. And what I really liked is that the company follows.
But, what was 4D dentistry before MODJAW? What was 4D dentistry concept for you? There wasn't any.
Nothing. And that was the missing link. That's the missing link, to the workflow, to introduce the fourth dimension, the time.
Exactly. So when we talk about 4D dentistry and how amazing this MODJAW can be for our workflow, for our daily use, it's actually the game changer. I think that this sale argument that we use, like the game changer, is actually we need to come through with this because it did change the way you look at your daily.
Very true. Just the opportunity to visualize the motions of the mandible, just to visualize and measure, and also to communicate this to the patient. It's unbelievable. I mean, I found that my case acceptance has been skyrocketing.
Really?
Because of MODJAW. Because I think that before people, when they are to do big cases, full mouth rehabilitation, they are thinking, but when they see the technology you have and how controlled and predictable things could be, then they get the treatment.
So, and tell me other thing, Dinos. How is the integration in your clinic stuff? So are your assistants playing with MODJAW? Are they used now to the technology? How's your team working with MODJAW?
At the moment, I'm doing all the measurements myself, but I've started delegating now, and I start, showing, to my assistants and other staff members how to deal with it.
But you don't have 1 year yet. You don't have 1 year of experience.
I'm very impatient. I'm Greek.
No, but
I want things to happen yesterday. Not today or tomorrow. Yesterday.
Yeah, but I found it impressive. Like with the new technology arriving in town, like you know, in the other side of the world, you know, during pandemic, during the August, I believe it was August or September. I don't remember.
Yeah, it was early August when I received it. Correct.
Exactly, and you know, during August, how did this? You know, my thoughts were, how did this guy is ending with the module during a summer vacation time, and you know, I would say like for October or November, we would have, you know, some news already by you.
Well,
you know?
put it this way: we are in the other side of the world. You know, October, September, August. It's like, you know, it's not summer. It's winter.
It's winter. Yeah. So you have the time to hibernate with the module.
It was business as usual here. Although myself, to tell you the truth, you know, I couldn't go to Greece. I always love to go to Greece, you know, from 1st of August to the 15th, like Italians, like Greeks, like French, like Spanish. Everybody's on holidays, right?
Exactly.
So I couldn't go anywhere. So the funny thing is I ordered the module and I went up to, and listen, I went up to North Queensland in Hamilton Island next to the Great Barrier Reef for a little holiday to be, you know, as close, and I feel as close to, you know, the beach holiday, you know, like Mediterranean, because there the weather is always great. So I received a phone call. I was, you know, doing some scuba diving, and, you know, I come out and I receive a call from my assistant saying, there is this big, huge box that arrived today for you.
This fridge, there's this fridge coming.
That's this fridge, you know, that arrived here for you. What is this? What is this? Where shall we put this thing, you know? And I think that's, keep it please safe, my baby.
So it was kind of, Dr. Dino, did you order some kind of wine fridge for you? Okay, perfect. And
so that was in August.
Would you say that, you know, the business model, the patient number did change since you using module?
Yes, and you see, not so much the case number, but the patient acceptance, because at the moment we have not advertised it at all yet. You know, we would like to advertise it in the next few months, and basically then the volume of patients we expect it to increase. But what we find now is that from the referrals that we have, we see that more people accept the treatment.
Wow.
So that's great. That's great.
And people like to see it working. Like.
And apart from this, it's a great tool. You know, because as I said, you know, I love to see numbers. I love predictability. I love things to be productive. I love things to be efficient. And this is something that I found, you know, with the MODJAW device. And it's also so great that I have the second license, to tell you the truth, in my other computer. I load the case, I go home, I have a glass of wine, champagne, you put it in and you just see the patient and you create a virtual patient. That's amazing. I mean, you can be at home and you have the patient in front of you.
So that's actually your workflow nowadays. You are taking the registrations, you are going home, taking a glass of wine, planning everything.
Correct. And now what we've been doing in the last couple of months, we've been working really close now to our dental lab. So we've been training the dental technicians to be able to use this information in exocad. So that's what we are doing at the moment. So we are trying to be as proficient as we can in the use of exocad so that we can give great cases and deliver great. So it's not only the diagnostic part that is great, because that's great tool for diagnostics, but also for the therapeutic part. So that's what we are doing now. We finished a few cases, and looking at this, you see, I've done, you know, I told you I'm very guy that I like tradition. I'm a traditional guy. So basically, when I received the module, I always, you know, before I use it, I always like my own articulators. I like to mount, let's say, on the first point contact. So I do a case exactly like I used to do before. And I go to the articulator and I say, where is my first point contact on centric relation? And I mark it. And then I do on the same patient, that was the first patient, I do the MODJAW, the whole thing, the record. And I go digitally and I close the
vertical dimension.
Find out where was the first point contact. And it was on the same cusp. So then I say, that's good. Money well spent.
This is working. This is working.
Money well spent. That's good. So that was great.
I believe that they were amazed with this kind of unprecedented
data. You see, that's the thing. I mean, we are doing now, we use also the face scans with the Bellus 3D. Of course, it has limitations, but it's a great tool that it's widely available, having a face recognized iPhones or iPads that they can recognize the face. It's a great tool to use. So we put these face scans, we do the MODJAW recordings, and we give this, and the technician straight away has in front the face. And they are doing a design of the smile with the patient's face in front and the motion of the mandible. And that's great. So for them, it's like a new world.
Yeah.
And it's a learning curve, true, because I see that they are really, really trying to be proficient with this, and they are really, trying their best. And every week I see that they are feeling much more comfortable using this technology on their design.
It's a communication enhancer, Dino, I'm a dental technician, and
you know exactly what I mean.
Exactly, the way that we are, able to have, I can say this expression, like the way that we can have the patient on our lab, inside our lab every time to check, different registrations, and to have them on Exocard is something, out of the box completely. The way we can now communicate with our clients as a dental lab, it's using the MODJAW data, using this unprecedented data is something, that I wouldn't believe 5 years ago. Let me tell you this. Let me come clear with this. I wouldn't believe that it would be possible to have a chat as bigger or small as possible with some kind of doctor anywhere in the world in this real time with a 10 or 11 hour difference, and talking and watching and seeing exactly what we're talking about when we see some kind of movement that we want and need to have on the lab side,
it's very true.
To be able to diagnose and to design a cusp angle, by having a shoeing cycle, for example, is something that, people are not yet prepared for this.
And you see, I can tell you, we've done a few cases, and I can tell you this for sure, that when we are to do the provisionals, we're doing the provisionals, and the provisionals were done from the design with the MODJAW motion in Exocad, the much less adjustments. So it's great. The patients feel straight away very, very comfortable.
Very comfortable
So
since the beginning.
Because before you were using, a virtual articulator, maybe you could program it, if you had the data of the condylar angles or the Bennett angles, but most of the time you were using average values, and then you were going and working on the provisionals to be able to fine-tune everything. And there was a lot of work. So what we find, and that's what I found in a few cases that we've been doing now, is that things are much, much faster. So you spend more time initially to do the records, but you save more time later.
And in the number of visits. And in the number of visits.
Correct. You save time, because patients feel great. The cases that I've done, they feel great. I don't have much experience, as I told you. I only got it a few months ago, but so far it's amazing. That's great.
Wow. And it makes us so happy to hear that, from our, new users, because I can consider you as a new user. and I need to come clear on this.
I am a new user.
You don't have 1 year of experience with MODJAW, so you are a new user.
I'm a baby.
You are a rookie with this technology. But you know, the rookies, every time we heard about rookie of the year, rookie of this, or rookie of that, yeah, I could consider you in this kind of rookie, like few months with MODJAW using. You are using MODJAW for a few months now, and you are already, having all this great experience with all this data and amazed with what you can find and have on your business model, and also with your lab and with your patients. That's the amazing part of this. So the conclusion, I would say, it has turned your life. It has changed.
It's definitely a game changer on the full mouth rehabilitation cases that I do. Definitely.
Wow.
It's really, really, I see this, every time I get the provisionals in and the patient comes back and they say, oh, I feel good. It's great. I feel great. And everything was designed with
properly, with motion,
correct,
with function.
Correct. And then, of course, it's a piece of cake to go and do, the finals. And that's the beauty about the digital, because you just copy.
Yeah.
You just copy the form. It's so great. While with the analog, things can change. But with the digital, you know that you can get predictability from day one to the final day. Actually, we are doing an amazing video with a case that I just finished.
Okay.
You're gonna see it soon.
Okay.
It's an amazing model that it was, we did the full mouth rehab for her.
Okay.
And, you're gonna see the video and you will understand what I mean.
Wow. That's exactly the kind of project that we want, That's the before and afters with the entire workflow, and using this digital technologies, this digital gadgets that you told about before. This is exactly what we want. Exactly. Yeah. During the pandemic, you are now not able to fly anywhere, but you were doing, as far as I know, and I heard about, you were doing quite some noise around the world, with your workflows back then. So tell me a bit of that experience before MODJAW. What were you doing actually, around the world? You were lecturing, right?
Yes. I've been involved quite a lot on teaching, pretty much, in a lot of places in the world before I come to Australia. And my interest always was minimal invasive aesthetic dentistry, minimal invasive or non-invasive veneers. And that's actually my love. And I've been doing this for years in Greece, and I had the chance to work with really talented technicians. And
like Nondas, for example, no?
Huh?
Nondas, for example, no?
Oh, yes. We've been doing some amazing work with very talented technicians, and the results were amazing. So I've been lecturing a lot on the minimal and non-invasive veneers. And after I got introduced to the philosophy of DAWSON, working together with Ian Buckle in Liverpool, my cases start becoming a little bit bigger. And actually full mouth rehabilitation cases for the last year.
Okay.
And that's my love
passion.
At the moment.
Your passion at the moment.
Yes. So the MODJAW really clicked nicely on this type of work.
Kick off.
And because I always love technology, I love gadgets, as I told you, and that's an amazing toy, I can say, that you can work with as well.
Wow.
And you can create some very, very good results that you can see them. And that's what I see on the everyday patient.
Wow. Okay, so what a perfect kickoff for 40 Talks 2021. Thank you very much for having us. Dino, I hope you had a good time as well, and hope to see you and meet you soon.
Perfect. Thank you very much. And it's time to celebrate the first the first talk of
40
2021.
Talks. 40 talks of 2021.
You will celebrate it with a coffee, but I will celebrate it with
a
champagne. It's about time.
Okay, perfect, Dino. Thank you. Thank you very much for having us, and hope to see you soon.
I thank you so much, and it's really, really a privilege being, and I thank you very much for the invitation, and especially being the first talk of 2021.
Our pleasure. Our pleasure. See you soon. Okay.
Thank you very much.
Bye-bye. Thank you.
Lots of greetings. Bye-bye.